Look at another tumor or cancer growth that occurs at the thyroid gland, and this is what is known as the medullary carcinoma of the thyroid. Medullary carcinoma of the thyroid. So, just so you know, it's a rare type of thyroid cancer and usually arises from the parafollicular cells of the thyroid. You know, you have follicular cells, you also have the parafollicular cells. So, these parafollicular cells, right, they produce calcitonin. So, I'm actually suspecting that if you have a tumor there, you have a lot of calcitonin being produced. Could be. Okay. So, origin is parafollicular cells, not the follicular cells, right? So hormone markers, it produces a lot of calcitonin, just like I was saying. You know, tumors or cancers when they come in, they dysregulate stuff and they make it that there's no law and order. So it's actually a diagnostic marker. So genetics is associated with what? Rett proto-oncogene mutations. So we have sporadic cases where somebody's just having it. No other person in their family have it. They also have familial cases, usually part of the MEN2A, that's multiple endocrine, neoplasia and the rest of it. So spread. You can have a tumor in the thyroid and it can spread. So common sites where it spreads the lymph nodes, the lungs, and the liver. This is a thyroid gland that was removed. You can see that the thyroid gland has lost its shape. The thyroid gland is usually what? Butterfly, like this, but has lost its shape. So clinical presentation, you have thyroid nodules, they are firm. You have neck lymphadenopathy, okay, systemic issues like diarrhea and flushing, symptoms of pheochromocytoma, then you can say family history. So you diagnose this using the blood test, you know, where you see that calcitonin levels are elevated. Then you fine needle aspiration. Also genetic testing where you get to see that there's mutation in the ret, the neck ultrasound, CT scan, MRIs. So now know which stage. So management is for surgery, you just totally remove the thyroid out, thyroidectomy. Okay. And basically that's it. Okay. So RET inhibitors like what? Salpercatinib or pralsetinib. Then lifelong monitoring of calcitonin levels.